And as cases of COVID-19 infections decline in the country, many Nigerians have become more relaxed in their response to the coronavirus. Some have totally abandoned safety protocols. But the Nigeria Center for Disease Control, that's the NCDC, and medical professionals are warning that lax adherence to safety protocols, especially with the resumption of schools across states and resumption of international flights, could pose terrifying consequences for the country. For the Director General of the NCDC, Nigerians must take personal responsibility to avert such scenario by strictly abiding to safety measures put in place to contain the pandemic, such as wearing face masks, keeping physical distance, regular hand washing, using alcohol-based hand sanitizers and surface sanitizers. Well, joining me via Skype is a public health physician, Lagos University Teaching Hospital, Dr. Ugunnaya Igwilo. Good morning and thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
Now, the concern the federal government has always had is with the fact that a majority of Nigerians are not taking responsibility when it comes to, the use of face masks, hand sanitizers, and keeping the social distance. What do you think is really at the heart of this issue, and what would it take for Nigerians to really adhere to the safety protocols?
Okay, so first of all, we've established that the COVID-19 disease is primarily a respiratory illness. Now, what are the protocols that are required to prevent, someone else from getting infected with COVID-19? First of all, we're talking about masking. Secondly, we're talking about hand hygiene, etiquette, ensuring environmental cleaning. Now, when we look at some of these protocols, we need to look at them in detail. Remember that things like social distancing, people from low-income neighborhoods, for example, may not be able to afford to physically distance. What I mean is that people that live in congregate settings. We're looking at, okay, let's use an example of transportation now. If, for example, like transportation buses require social distance or physical distancing, remember that will come with costs. Things as basic as water. How accessible is water to everyone, for example, in Nigeria? So I know that, yes, we are talking, we want Nigerians to ensure that they do it because it's for their own good. Every day we're having cases. Every day people are losing their loved ones, mothers, fathers, grandchildren, even grandmothers as well. So, these are lives being lost. So, of course, we keep engaging. The important thing is to keep engaging them. But at the same time, we also need the government to also step up because, there has to be an equity-based approach to this, to observing these measures. Because yes, it's enough to tell them, oh, mask, physically distant, oh, ensure you wash your hands. But do they have access to the water? Can they afford to for example, how much? Because we don't know how much they have to even pay for water. Of course, the masking, yes, they can do that. But remember that those masks have to be washed every day. They cannot just wear them and wear them throughout. So definitely, we have to keep engaging them, using our traditional leaders, using the community leaders, keep talking to them. But at the same time, the government, even, civil society, of course, other partner organizations also need to come in and also find a way to ensure that, even
if
those
I may
who cannot
interrupt your line, if I may interrupt your line of thought, Dr. Igwilo. Now, what the director of the NCDC is saying is Nigerians should perhaps stop looking at what the government cannot do, but focus on how they can, ensure they are safe first. But how do we then balance this? You talked about an equity-based approach. If we are saying, if government on the one hand is saying that perhaps you shouldn't be looking at what I am not doing, but ensure that you are safe in the first place.
Okay, so let me just cite an example. It's like being in a home and you're a mother and you're telling your child, wash your hands. Make sure you wash your hands every day or take your bath every day. And you're not providing, there's no water in the house. There's no soap. Like, how would that child do it? So that's where the equity-based approach comes in. Yes, definitely, Nigerians have to take responsibility for their own, health and their own actions. But there are some things that are beyond their control. You can't tell someone who can't afford to have a daily meal. For example, maybe that it's just that one meal. Because remember that some of them have to buy water. They have to buy, in fact, transportation is already costly for them. So definitely with the masking, yes, we want Nigerians to, ensure that they take ownership of their health, because it's their health. Once they die, it's their loved ones that suffer. No, not strangers, not outsiders. So definitely they have to take. But other government or partner agencies, or philanthropists also need to come in, because remember that not everybody can afford some of these measures that are being reiterated that they have to do.
All right. Now, another aspect that some persons are looking at, that perhaps the government should look into persons who perhaps have recovered, because some persons do not believe that there is COVID-19, that perhaps people who have recovered from the virus should be used as ambassadors at propagating the message of staying safe and adhering to the safety protocols. How do you react to this?
Okay, so first of all, we know that there's the issue of privacy and confidentiality in terms of in medicine or in clinical practice. Now, fine, if the survivors have to come out, that's fine. Of course, you see that on a daily basis, the government is even encouraging some of them to come out, but it helps, especially when you see some of our politicians who fall ill who contract the virus, and they come out and say, see, I've contracted the COVID-19 virus, and they go into the isolation centers and they come out. So when Nigerians see this kind of thing, at least it builds their trust in the health system. And remember that there was a documentary by BBC at one time that talked about I don't know if you had seen it, in Luth, where they showed a documentary on patients who had been ill, yes, those who were severely ill. Yes. Now, stories like that also help, and definitely encouraging people to come out and tell their stories also help, because I guess that's part of the issue around. And of course, the issue of stigmatization doesn't help, which is why the issue of continuous education, engagement of the community, making sure that awareness is also improved among individuals, or of course the society, because that also helps. Yes, people will come out, they'll be able to tell their stories and tell people that, no, this is real. But I guess that's one of the reasons why people don't believe it's there. Because when people have it, they're hiding because they're scared of being destigmatized. So they probably hide away the fact, but it's real. Even if we don't see, we are seeing what is happening all over the world. And you're hearing stories, and you've heard of politicians, even people who had come out to say they had contracted it. And even in the isolation centers, they have patients there. So most times it's documentaries like that really help.
All right.
To push the narrative. Yeah.